Okay, I'm going to talk about some potential emergencies when we're doing manual vacuum aspirations and some things that we can do to help our patients out and help the provider out. Patient has a vasovagal. Sometimes that can happen during any part of the procedure, really. Sometimes just the medications, they get a little dizzy when they get into the room. Sometimes that initial block, they can get a little vasovagal. Patients will start feeling faint, dizzy, get really, really sweaty. The best thing you can do is turn them to their side and get the barf bucket, which we have here in the room. Get a wet washcloth and put it over their head. That can really help and grab some juice for them. If their head is elevated, you want to put their head down, so that will help with the vasovagal. A nurse will come in, or you can go ask for the nurse to make sure they come and get some vitals. And usually they pop out of that pretty quickly. At that point, we can offer, if they still want to do the procedure here, they can, if they're feeling okay. But if they're like, this is too much for me, then at that point we can say, hey, let's just do this in the OR, and we'll schedule them for the OR. Vomiting, again, that's pretty much the same thing. If they start vomiting, it's usually a vasovagal, so just do the same thing. The main thing that we worry about is heavy bleeding with this procedure. The main thing that us providers will need when there's heavy bleeding is millions of those Q-tips and millions of gauze. So we're just going to be applying a ton of pressure. Sometimes we just have to keep doing the procedure, because if there's anything stuck in there, if there's not an ultrasound, get an ultrasound so we can see what's still in there. But mostly we're going to need gauze, and we're just going to be holding a lot of pressure. We are going to have Methergin. It's a medication that helps the uterus clamp down in the clinic, and it's just a IM injection that the nurses can grab, so we can ask for Methergin. Another thing, we do have Foley induction balloons in the clinic, so we might ask you to grab one of those with some saline and some syringes, and we can actually thread a Foley balloon up inside their uterus and use that to tampen on the bleeding. We'll probably rarely ever get to that point, but if we do need to do that, that might be a way to stabilize them and then transfer them over to the hospital via wheelchair if they're stable enough, or call 911. However, I do not expect that will happen at all or often. So that's it for emergencies.